Hi, everybody. Welcome to The Ethics of Now from Home. I'm your host, Adrienne Lentz-Smith. The Ethics of Now are a series of conversations hosted by the Keenan Institute for Ethics that we normally do in downtown Durham amongst the community. The pandemic has changed how we do most things, but we thought that it was important to continue having conversations about the world in which we live and how we live in it. And that, in fact, the pandemic required an exceptional moral imagination and called for ethical thought and action. So we're going to keep on going. And today we're going to talk about care in the era of COVID-19. Here's how this conversation will go, or how this webinar will go for those of y'all who have not been with us before. Basically, I will talk with our guest until about 7:40. You'll just see the two of us, but there are a team of folks from Keenan in back to catch any technical glitches, Zoom bombers, or minor emergencies. And then at 7:40, we'll turn over to Q&A. Your chat function has been disabled, so please use the Q&A function, which is kind of right there down at the bottom of your screen, to submit questions, and we'll try to get to as many as we can between 7:40 and 8 o'clock, and we'll try to get you out of here promptly at 8. After this is over, we will send you a link to this conversation. It'll be recorded. And we'll send you a reminder, or we'll issue a reminder of conversations to come. But for now, let's get started on the one that we are in. It is my great pleasure to introduce Jolie Olcott for today's conversation. Jolie is the Margaret Taylor Smith Director of Gender, Sexuality, and Feminist Studies, as well as a professor of history and international comparative studies here at Duke University. She is the author of 2 books, most recently, International Women's Year, the greatest conscience-raising event in history, which considers the legacies and the history of the United Nations' first World Conference on Women, which was held in 1975 in Mexico City. She's currently at work on a biography of the activist and folk singer Concha Michel, a one-time communist who became an icon of maternalist feminism, and a vocal advocate for recognizing the economic importance of subsistence labors. It's under contract with Duke University Press. The book follows Michelle's life story from the late 19th century into the 20th to examine the ways that the concept, labor, and policies surrounding motherhood articulated with major shifts in political and economic thought. Jolie has also embarked on an international interdisciplinary project, many inters, centered on rethinking the value of care labors, broadly speaking, including not only dependent and household care, but also, for example, environmental, community, cultural, and sexual care. And that kind of line that describes this project is a good place to start, because I've been thinking a lot lately, and actually thought about it as I was walking my dog recently. Jolie is also the proud human parent to a dog, Maxine, who makes my dog look mellow. But I was walking my dog recently and saw a number of signs posted to as thank yous to everyone, from the garbage collectors to the Duke Health System folks who live and work in the neighborhoods surrounding my home. And I looked at those and thought, we've been doing a lot of that there's a more vocal expression in how we value people who give us care. But as I'm always coming back to these questions of what do these words mean, I was like, what does it actually mean to talk about care and to talk about value?
Yeah, I mean, it's funny because I think that there's a lot of things to hate about COVID-19, right? Including the fact that we're not like having this conversation over beer on your porch rather than over Zoom. But one of the things that we've gained from it is that it's accomplished what, decades of feminist theorizing and activism hasn't, which is to draw widespread attention to not only the pervasive care labor that underpins everything we do, but how badly undervalued it is. And I think along with that, the way that the undervaluing of it is embedded in a particular labor history and a particularly raced and gendered labor history, so that the devaluation of care of various sorts, and I think that gets linked to that, particular demographic patterns. But I think the other thing that's kind of interesting about it is we are starting to see, I think that in the liberal imagination, the idea was that there would be a series of things that would solve the problem of care labor, that there would be kind of market solutions, and that in the fullness of time, demand and supply would all balance out, and you would end up in a way that care would be valued, at least on the market, in a more just way. And then there's another, I think, set of ideas around state policies and around technological solutions that people have often turned to. And none of that has really panned out. That is to say, care, the most critical forms of care remain badly undervalued, which is what we see here. But that the state solutions haven't really, not, putting aside the fact that state solutions aren't viable in much of the world, but they haven't even really panned out in the places that they're meant to function. And the technological solutions have turned out to create as many care problems as they have solved. So I think it's an interesting moment to be thinking about about the value of care, but I think it's also a moment when all of the questions and conversations and debates within that scholarship about care and what it is and how to value it can teach us a lot about the world that we want to create on the other side of this. And that's what I think is really interesting. I do think, the question of care, I have a set of debates with a lot of friends and colleagues who work in this area. I have a colleague, Kathy Weeks in GSF, who wrote this fantastic book called The Problem with Work that deals a lot with this question of social reproduction. And she hates it that I use the term care because she feels like it makes it seem too kind of soft and squishy. The reason I insist on using that is for a couple of reasons. One is that I think there is an emotional part of care. There's people argue about this, but there's this term that a lot of social scientists use where they call it love labor, because there's a part of it that's about attending to and listening to and thinking about questions that isn't just about the actual labor of it. But then I think the other part of it is that it needs to be thought of as this deeply relational question that isn't just about the labor that goes into it and the labor of social reproduction. But she would argue about that.
So it seems like part of that response comes out, when you say the word care, right, it could mean a million different things.
Yep.
And the part of me that it just had to pull my son by his ear into doing a report on the digestive system,
right,
sees that kind of care. But the African-American historian in me is actually thinking about Black women's labors in other people's household as care work, right? And maybe, there are narratives for the children who were raised by Black women where they talk about love and affection. But I think for the women who did that work in domestic labor, they wouldn't necessarily have a soft and squishy story, right? So what is care?
Well, this is something that people argue about. I will say this, though, about the soft, squishy question. That is to say, that this sort of affective, emotional. I think it's so one of the things that does characterize care labor of all kinds of things is that, there's a few things. One thing that I think is particularly interesting about it is that it is labor that is often performed in both commodified and uncommodified or semi-commodified forms by the same people, sometimes in the same day. Right? So you could have somebody who is caring for her own children at home and who maybe engages in some sort of childcare sharing relationship with somebody in her community as well, and performs care labor for a wage, all in the same, those are all forms of the same thing. And that variable relationship to commodification, I think, has a particular impact on this. But the other thing that I would stress is that I think it is a mistake to try to find a neat divide between this is labor and this is care. That is to say, people who are being, and it is overwhelmingly women, and it is overwhelmingly women of color, like that do a lot of this labor. So I want to stress that. But to say that people don't have a kind of affective connection to the things or the people or the societies and cultures they're caring about, I think minimizes part of what that labor is. And that it was interesting. We ran this Basque Connections team this year on that I initially called the value of love, because I was sort of interested in that question. And students, and it drew, as these, I think Basque Connections projects often do, it drew these.
And we should tell the audience, the Basque Connections is this like interdisciplinary teaching, undergrad, graduate, faculty, teaching and research. Sort
of teaching and research thing. And the thing that's cool about it is that it's really vertically integrated. So this one had everything from like very senior faculty to first year undergraduates, and to have postdocs and graduate students from all over the university. And so the conversations, and this one happened to attract a lot of students from all over the world. So there was, people whose families were from Vietnam and Kenya and Ethiopia, and it was just really, a really wonderful, super smart collection of students. But I was struck by the fact that for them, there was this sort of trade-off between compensation and authentic caring. And I don't think that's actually how many of us, I care deeply about my job, often in affective ways. I still think it's a job, right? And so I think it's important to be able to keep those both in the same frame. But it is true that one of the things that probably most defines care as a practice is that it has this affective dimension, and that it's deeply relational, whether that's a social relation or a non-social relation, but that it has a relationality to it.
So you're saying that it's many people doing the same job on the same day reminds me, I spent a lot of time on the NewYorkTimes.com webpage or pages in the last few weeks. I don't know why.
As one does.
Right? And there are a few, there's actually this really wonderful video essay about nursing assistants, right? And kind of what their days look like and how they are, again, to go back to value, like they make so little for work when they are really if there are front lines of this, on the front lines of this. But there was there were two different people. One person who was saying, not only am I at risk, but my mom has diabetes. My dad just recovered from thyroid cancer. I have asthma. So it's not simply that he's going from household to household to household doing care work, but that he has care then of his aging parents, and then self-care that all gets bundled up into this. And a similar woman who was raising her grandchild, who had those kind of concerns, but also the raising of the grandchild is another kind of care work. And so you're right that this is a moment when all kinds of labors around this become visible. And I think for some people, the discussion of care is shorthand for talking about doctors and possibly nurses. But if this experience has done nothing else, it's actually made us pull back and see the interlocking networks of people.
I think it's also made visible, which again, I think a lot of us knew, but there's a ton of care labor that's going on within households that is, let us say, unevenly distributed, right? And this isn't breaking news. I will say it's a little bit of a pet peeve of mine that we keep saying, like, well, we just have to collect more data. We truly we're not lacking data on this question. We are lacking political will to address it. And that's a much heavier lift, but we actually have a ton of data about the distribution of this labor, and it's badly uneven. And so I think when we think about, I keep sort of returning to this, like, what is the post-COVID world like? What can we imagine changing? There was this, Bruno Latour had this series of things that he put out. One of them was like, here's the kind of charge for imagining our post-COVID world. Like, what are the things that we want to ditch? Like, what would we get rid of? A friend of mine was like, we could get rid of cruise ships. We could get, like, what are the things that we could do without and the planet could do without? And what are the things that we would like to to create. And I do think that thinking about what's been said in relief by this, first of all, the maldistribution of care, but also the ways in which the needs for care get, I mean, one of the things that the care literature really stresses is that we all need care, and we all need care at different points in our life, but that we also all need to give care. That is to say, there's a benefit of caregiving. I mean, there's actually a pretty sizable literature on this that's about the physical and mental health benefits, or physical and emotional health benefits of caregiving. And not just for, I mean, it's a lot of it's about loneliness in the elderly, that maybe is the most conspicuous place, but that all of the benefits of caregiving to people, and so that when we exclude people from caregiving, that also has a cost. But then the other part of this is when we start thinking about who needs care and why, it raises a whole other set of questions. So for example, disability studies for decades now has made us see the ways that certain kinds of normative thinking make us think that certain people are needy because they are lacking something or whatever. And I think that whole body of scholarship has and conversation has really shifted those debates. I think what we're seeing now is when we think about, just to point to one obvious example, the really disproportionate effects of COVID by race, right, has drawn a lot greater attention to the ways that certain racial populations are made more vulnerable, their immune systems are literally compromised by racism, right? So that the just quotidian, and not just because you can get shot while jogging, but just the quotidian indignities can lead to a kind of wearing down that makes you physically more vulnerable to something like a virus. And these are things where we start to see how deeply care underpins all of this, right? So the care isn't just about, are you like changing the diapers and feeding the kid, but it's and this is why I really insist on the affective and emotional parts of care, because it needs to be a kind of paying attention that goes beyond the simple labor, if that makes sense. I don't know if that was too winding a path to get to where I wanted to go, but I think the current crisis is making us unable to turn away from some of these things that we've needed to look at for a long time.
So, having looked at them, what do we do about them?
What do we do now?
Tell me, Jolie, what do we do now?
So that's part of what this whole research project is about, and part of what we're working on. And I actually, I was really deeply sad because we had to cancel this conference that I had planned on this. And then I realized that we could do something that I think is going to end up being much cooler. If anybody out there listening wants to be a part of this, I'm excited about it, which is I think we're going to do a series of sort of mini conversations, and I think we're going to try and turn them into podcasts, actually, that will be centered precisely on this question of, okay, what are the lessons learned from this crisis, and what do we do now around different aspects of care? And again, I want to keep in the frame. In fact, I think that really imbricate are the questions about ecological care and social care and cultural care, and so that one of the things that we can do is think about how those are tied together. I will say, when I'm looking for solutions, so I don't have, if I had the like quick and dirty solution, this would be, right, this conversation would be over by now. I would just like hand you with a memo. But I will say, I think there are places that I think we can look for some more promising solutions. That is to say, to me, and maybe this, as you know, I am a historian of Mexico, so we've been thinking about the predations of neoliberalism for a long time, because that it really starts in Latin America earlier than it starts here. It starts in the early 70s in Latin America. And so the impact of all of that is to say, of the heavy emphasis on market solutions and commercializations and private individual solutions, is really what we're starting to see now. And so to me, it seems like a big part of the solution has to be looking at what communities are doing in places that are less inclined to use that toolkit. And the places that this research group that I've been developing, I along with a whole group, it's not just me, but it's a really fantastic collection of scholars from all over. The things that one of the things we've agreed on is that there are some practices that are coming from the places that are least embedded in neoliberal thought. That is to say, where this set of assumptions about market solutions is not just part of the common sense. And I would say the places that we've been looking are a lot of indigenous communities, places in the global south that are not, so a lot of places that are thinking about commoning, and places where it's not, there's a lot more suspicion of that kind of, sorry, that's the oven, care, where there's a lot more suspicion about markets, state solutions, and technology as the kind of trinity of problem solvers. There's a group, part of this network is this group that's based in Australia and New Zealand called the Community Economies Research Network, that's really focused. They actually have, two of them have produced this, two editors have produced this handbook of diverse economies. So how do we think about diverse economies? I think there's a lot of solutions out there.
What does that mean? When they say diverse economies, what do they mean?
So thinking about, are there non-capitalist, non-market, and I should say, I know I sound like I'm a market hater. I'm not a market hater, but I do think that we've kind of come to understand, because I think the markets are actually useful for sorting out needs and priorities and all kinds of things. We have come to a very narrow understanding of what markets can be and what they can do, and how reliable they are at ascribing value. And in care, there is pretty much an almost inverse relationship between value and profitability, right? And so markets fail badly in areas of care.
So will you actually, in some ways super basic, pull back, what are other ways to talk about value besides market ways to talk about value?
Right, so this is
because even my instinct is to be these people aren't paid enough, right?
And I just, before we go too much further, we should pay people better. I don't mean to say that
I don't care about markets. We shall all work for free.
Let's be post, I think, and I think that there's some pretty obvious solutions that have not that they're ready and they're complicated in their details, but things like a universal basic income is something that I think a lot of people have floated as, and universal basic income in some ways is where they've ended up in the middle of this crisis in a lot of parts of the world. They've paid people to stay home, right? That the safe thing to do is not to be going to work. And so they've kind of just provided a basic, a kind of baseline income. But what are other ways to describe value? I think that's one of the things that we need to think creatively about. And in a lot of societies, certainly the other part of this is time. And a lot of people would rather have time as something that they could have rather than just money, or more autonomy. But how do we ascribe value other than money, I think, is one of the things that we need to figure out, is to find a way to and not, I will say, not in that Mother's Day card way of no, we really value you, you're great, we're still not going to pay you a minimum wage, right? So I think that's part of the challenge of sorting this all out.
I'm still thinking, I keep coming back to sort of care 101, what do we mean? What does it capture? What does the term do for us? And there's some part of me that's sitting here imagining care as the depot in which a number of tracks run in that tell us something that the crisis in health that we're seeing and the pressure on caregivers comes through this track on the environment and the ways in which, the concentration of pollutants in certain urban or rural areas makes people vulnerable through this track in ways that they wouldn't otherwise be. Another one that's about the kind of weird way in which healthcare is structured, where not everybody has access when we need, right? So that it is if this is about care in the era of COVID-19, then one of the things that we see is how the demands on multiple kinds of caregivers speak to many, many kinds of problems. Is that a crazy Is that
So I don't know if I'm going. I'm staying with you on the depot metaphor. I'll be honest with you, because to me it seems too like too intricate a problem to be able to kind of sort it out into a number of different train tracks. If that
like
makes
you
sense.
can't just come. It's not like Grand Central Station. You don't get in and go, that fixed
Like,
that way. That fixed
like
that way.
come in on the child care train and go out on the like environmental care train. I think that those things, and in fact, one of the things we see is that the challenges of something like childcare or elder care or self-care get greater as we don't also attend to things like cultural care and ecological care, right? And so I think, and thinking about, social networks and questions like that. But to your earlier question, I mean, what are some other possibilities? I mean, I think there are all kinds of, and even within the United States, which again, I think the common sense here is much more one of like, we just need to make this commercially viable increasingly. But there are all kinds of intentional communities where people have tried to provide mutual care. I mean, even now, I think one of the things that's come out, and I think that there's some people are ambivalent about this, but the mutual aid societies have reemerged. It's like a good 19th century practice, right? Reemerged as something that where people are taking care of themselves. I will say one thing, the other thing that COVID has made clear, and not just in this country, is the ways that we can often quite starkly draw lines around our communities of care and deciding who is in and who is outside of our community of care. So something like these mutual aid groups, which I actually think are pretty cool as a practice, there is this thing of like who gets the mutual aid. It is, by the way, the kind of fundamental question we think about. So we live in a country where vast amounts of the care labor are done by immigrants of variable documentation, right? So and we obviously live in a moment when we have a lot of conversation about migration as a practice and wanting to define people as legal or not legal. So that on the one hand is the part of care. On the other hand, the kind of social services part of care, like who has access, ends up being a question of, can you describe that community? Or do you come to a place where you say everybody should have access to universal healthcare? This is, by the way, where I would end up. So maybe I'm tipping my hand. Like, I do think that the whole planet should have universal healthcare, and I do think that everybody should have high quality childcare and education. So then the question is, what would we need to reprioritize to make those things happen? But instead, what we have is it's often framed as a trade-off of like, okay, if we're going to be able to provide certain levels of care, whatever that care may be, we have to have this very hermetic community of people who get that. And you see it, in kin groups, in faith communities. And I mean, I think that you see it in all kinds of things. But this crisis has really highlighted both the possibilities and the dangers of describing those kinds of communities of care.
I mean, maybe actually what you're saying already begins to answer a question that I was going to ask you, which is that you've got this research project on care as a global research project, right? Yeah. And I'm wondering, given that you're a historian of Mexico, or given that you live in the US, not just how do you pull it off, but why think about it globally? And how does, again, this moment with COVID-19, like how does that make you reflect on your decision to think about it globally?
Right. So in part, it's because the questions about care in that broader way, I mean, almost in that, like, I care way, like I care about what's happening someplace else, that we have to think in that more all-encompassing way if we're going to address it. I mean, also because all of these things are intertwined. So the sort of, since the 1990s, we've been using this term, the crisis of care, like what undergirds the crisis of care. And that term, it often refers to the fact, all kinds of things. It refers to people, the so-called sandwich generation, who are both caretaking for young children and caretaking for aging parents. It refers to the impossibility of many families to find adequate childcare when they have to go to work. It refers to the atrocious compensation for people doing all kinds of care work, whether it is working in grocery stores or providing food or taking care of the environment or our waste or taking care of our children, right? So there's all of these kind of crises of care questions. Those get bound up with issues that have no borders. Like political borders are certainly not relevant to the ecological questions at stake, that we know very clearly. But it is not just within the United States. Around the world, care labor is done overwhelmingly by migrant workers. So that's the case in Lebanon, that's the case in Japan, that's the case, right? So it's not, and there's these vast movements of people, often, so in most of the world, capital and goods move much more freely than people do in a legal, in terms of what is juridically sanctioned. But the fact is there's these vast movements of people around the world to provide care and then leaving behind crises of care at home, right? And many of the technologies that there's one of our postdocs this year, Ingrid Mikas, works on the care robots. So care robots create all kinds of ecological crises and social crises in the places where they're being created.
What is a care robot?
Oh, you haven't seen care robots? Wow, if I could do this quickly and screen share, I would. But like they're big in Japan, but they're robots that are doing all kinds of elder care, and they are built to provide care. That's their job. But it's a thing.
But they create ecological. I'm sorry, I took you away from your point.
Materials that go into creating a care robot, then in places like Congo, right, create all kinds of other problems.
What kinds of other problems?
Slave labor, for example, but also, right, so, and warfare and ecological predations, right? So just like all kinds of bad happening this is the same thing we see, we have, well, you have a flip phone, but a lot of us have a smartphone. But I think probably even flip phones rely on materials that are,
right,
have to be mined in certain ways. And certainly labor conditions in China creating that flip phone are probably no better than the labor conditions in China creating my smartphone, right? And these are some
labor conditions in China 20 years ago when this phone was created are no better than
precisely. So part of it is, caring enough to think about what are the conditions that allow for care, and an insistence that everybody deserves care, right? That nobody should be described outside of that community in a way that they aren't getting, right? And I think that is a general ethical principle, to put it in the Keenan terms.
So then what is the responsibility, what might you term the responsibility of those of us who care? So not talking about care work as labor, mm-hmm, emotional or what have you, but if you say, okay, I've pulled back, I've looked around, I see, mm-hmm, that, mm-hmm, this is happening. Like how do we translate our caring into some kind of meaningful action?
Right. So I'm somewhat of a pragmatist on this front, which is to say that I think we need to think about some immediate questions. Like, I think certainly a living wage for everybody and universal healthcare and just some really basic human rights need to be met. But then I do think we need to step back and think in really fundamental ways, how do we think about the question of value? And can we get outside of a sort of monetary system or a simply kind of market-driven conceptualization of what constitutes value? And not just value in a, again, soft and squishy, I value this way, but value in a way that actually gives people control over their lives and some sort of, power to do the things they want to do, right? And that, I think, is the much bigger question that we need to address. So the part of, how do you do it or how do I do it? I think we can fight on both the, really immediate ways of supporting labor rights and that kind of thing. But I think that and you know, insisting on better ecological practices and kind of questioning the commercialization of everything. But I think the other thing that we can do is and this requires, you know, like, neoliberal capitalism wasn't created in a day. I think it is going to require a much more thoroughgoing rethinking about how do we think of the question of value. There's this, I mean, the old feminist economist stuff, like going back to, you know, Marilyn Ware, one of the feminist economist critiques was that everything that we do is measured by GDP. And it is this kind of bananas thing right now where a lot of us are working harder than ever, and the economy is supposedly collapsing because we aren't productive enough, right? Because none of this labor is seen as being productive labor, even though, you know, there's just a ton of labor happening and it doesn't count. And so Marilyn Waring, who's this sort of famous New Zealand economist and politician, I guess, talks about the problem is that in gross domestic product and GDP, and then the kind of international version of that, which is a system of national accounts, that, you know, it balloons with war and, you know, cancer and, you know, things like that, but it actually shrinks when you are caring, right? And so I think the part of it is, how do we reimagine what counts as being worthwhile in a way that counts for care? Now, this is where things get tricky, and I think that there's a lot of argumentation about this, which is, do we just want to shoehorn then? I mean, I think there's argumentation among feminist scholars and feminist, you know, economist theorists. Do we just want to shoehorn all of this stuff into a kind of accounting mechanism? Is that the solution? And, you know, people who are critical of what that would do. And then those who say, look, if we don't count it, no one's going to see it. It's been a kind of visibility project. I do think that part of what this larger research project is about is, can we imagine some other ways of exploring questions of value that is counting and indexing, and now there are, you know, dozens of these indexes that try to incorporate this stuff, all of which though basically fundamentally come back to GDP. Is there a way of doing this that would accomplish the visibility and accomplish the recognition and accomplish the giving people of autonomy and power without having it be a simple reduction to accounting?
Right. That, and accounting and counting, that it's it's the countability, the quantifiability of it that makes it the thing that people use, right? And the fact that people use it is the thing that then gives it its power.
Right, correct.
I mean, I have a whole nother set of questions. It's 7:40, so I can't ask them, but I think I have another set of questions about, I mean, we sort of began with, and of course, the majority of the kind of work that we're talking about is done by women. And so it's, you know, there is a history of the ways in which this work became gendered as female or as women's work that we can't get into, but that I'd like to sort of bookmark as a thing worth coming back to someday.
Beer.
with alcohol. So I am going to turn to the Q&A. Y'all send them in, and we will get to as many as we can. The first question to open it up is, money is a necessity. We need housing, we need adequate food, transportation, etc. And these are things that many paid caregivers, and especially unpaid caregivers, can afford. Doesn't monetary compensation have to be the first approach to value? How do you envision multiple facets of valuing care that still enable people to survive in an American market economy?
So that's the, so to speak, it's the $1 million question, right? Which is that, is there a way to get outside of, I mean, certainly when we think about utopian solutions, like the utopian vision that animated a lot of revolutionary movements was to try to get people out of that. I think even a lot of ways the vision that animates things like the universal basic income movement, it imagines that you could get people out of this dependence. In other words, it sticks with the monetary solution, right? That everybody gets paid something, but it provides a way that people would be able to make decisions on their own about how they spend that money, and they don't have to necessarily participate in a labor economy, labor market if they don't want to. You know, I mean, you and I are historians. I think we tend to go to the ways that this got systematically dismantled within the United States, and certainly the 96 Welfare Reform Act, which basically said, you know, removed recognition from all of that labor in a really definitive way, was an important turning point. So I think, yeah, there's a lot of things that we could do to roll all of that back that would make a difference. But I think that I would like, I mean, I agree with the question that this is a problem, but I still think that unless we can think beyond monetary solutions, we're going to kind of end up in the same place.
So, and I think that for me, I have an even more modest goal, which is that, one, I agree, like people need monetary compensation, period, right? They need more of it, particularly people who are at risk. I mean, people need to be able to stay in their homes in a market economy. But there's also—
can I just I know, hold on to that thought. But what people need is they need places to live and food to eat, and they need people.
Right, and those things could, if you could imagine a world in which that weren't tied to money, that would be. But let's go even beyond like the material to, like, I think that, I mean, this is not adequate, but I think it is also important, a shift in messaging, because I think that there is a way up until recently when all of a sudden we saw people doing all kinds of labor that we just ignored, in which there were all kinds of things telling people that they were worth less for doing things that weren't as well compensated. Yes. So part of it isn't about like, it's less about sort of naming value than pulling back from assuming less value to certain people in certain populations, right? And that's the flip side of that.
Yeah. I mean, I don't think it's mere coincidence that in this country that the populations that are doing most of what we are now calling frontline workers or essential workers are often the same populations that, you know, in earlier generations would have been enslaved, or even in the current generations are in part of immigrant communities that are systematically marginalized, right? And so I don't think that that's the kind of demographics of this are an accident.
Right. And so that there's other kinds of empowerment, maybe value is not the right word in that, but other kinds of empowerment that, that you would want for people. So the next question, as we're thinking about value of work and our relationship to it, would it be fair to question whether wage caps in tandem with the living wage question is a feasible solution for income/wealth disparities in the future?
This is the Thomas Piketty solution, right? That this is, Russell was just reading Thomas Piketty for, you know, and the whole thing, right? The whole like, which is all about the problem of inequality being the most fundamental problem of our time. I think, you know, so Piketty doesn't deal with the question of care, which is interesting. I do think that that would solve maybe some other problems, right? That is to say, the question of inequality and whether if you put some kind of salary caps on, and you know, and certainly in societies where there's less disparity between the highest income earners or the highest wealth owners and the lowest wealth owners, you know, that those are solve all kinds of other social problems and tend to have better systems of care, state systems of care. So in other words, things like healthcare is better, universal childcare, that kind of thing. I don't know that solves the value question, but again, I am of the like, throw everything at the wall and see what sticks approach. That is to say, if this will get us some way towards solving the problem of care, I think it's worth trying. And certainly solving the problem of inequality would solve all kinds of other problems. It's worth pursuing whether or not it fully addresses the care problem. That said, I think that the fact that there's such a marked sex and race aspect to care provision indicates to us that it isn't simply about wages. That is to say, there's another dynamic at play here that has to do with the history of these labor practices that isn't just about wage inequality or salary inequality.
Yeah. I have no answer to add to this question, except to say that the question of feasibility, like you could take that question in two different directions. Might it work? and would people be willing to try it or adopt it in particular places? And I think those are actually separate.
Would people be willing to adopt salary caps?
Yeah, right. But if you proposed it in the United States, say.
I mean, I think that, so in like the model they used in Japan, right, was that the highest paid executive could only make X amount. Was it 7 times? I'm going to get this all wrong. This wasn't in the like show notes or whatever. I didn't prepare for this, but it's a multiplier of the highest paid and the lowest paid employee. Other systems are that you have, 99% taxation above a certain astronomical amount, and so that there's not an incentive to do that. So all kinds of ways you could structure this that are adopted in other countries. Like, it's not like,
I didn't say it wasn't. I just said it was a separate question.
But I certainly think that the feasibility, again, that's part of the, like, do we have the political will versus do we have but this is something that we could make happen if we decided these were priorities. And I will say, this is where the care question, like, do we care about things enough, is important. Like, do we care enough to solve this problem? Are we going to cultivate the political will to make it happen? Right. And that, I think, is on us. Like,
right. Here's another question for you, Joel. Do you like how I'm not posing them as just questions for you? I'm just here to read. Do you have an alternative to GDP? Isn't the risk that you replace GDP with some other imperfect measurement tool?
Yes. That is the short answer. So there are a lot of alternatives to GDP. There's like the Global Happiness Index and the Development Index, and there's a lot of these different, and I agree that pretty much every one of them starts with something about starting with market measurements. And I agree that there's this challenge that if you don't measure it, you just erase it. I will say there is part of me that is also kind of nagging at myself, saying, like, well, isn't that just the neoliberal mentality at work, that you just have to, that if you don't literally count something, it doesn't count? And is there a way to get away from that entirely? And we don't have one yet, but that certainly is part of what I would like to. And I think that the Diverse Economies group, this Community Economies Research Network crowd, I think that's a lot of the questions that they've been asking, is how can we reimagine that very question? And I actually, one of the folks at Kenan, who's also at Stanford, Dirk Phillipson, who wrote a book called The Big Little Number, The Little Big Number. Anyway, it's about the history of the GDP, which gets into precisely these questions. I mean, one of the most famous feminist economists, Nancy Fulbright, who's like a MacArthur genius and everything else, has spent a lot of her time trying to think about, can we come up with a better system of GDP? I think someone like Marilyn Waring would say, scrap the whole thing. That's a trap, basically. I think that's still a fight that's going on. I can see both sides of it, and I'm agnostic on it right now, only because I don't have a better solution. But I think there are problems in both directions. I will say that. I don't think that eliminating it, I think the risk of eliminating it is you just make invisible all of the labor anyway.
So that's very professor of us. I will reiterate. So we've just given you a reading list of Nancy Fulbright, Marilyn Waring, and Kenan Institute Senior Fellow, Dirk Phillipson. Next question. Wow. So I'm going to learn a vocabulary word in reading this question. North Carolina in general has a decubitus rate, the number of patients getting pressure sores in nursing homes. This score is a good indicator of the quality of care given to the patient. What does it say about us as a society that we allow this to happen? Why can't we mobilize to get folks the care that they need?
Yes. I also want that word to be like on the spelling bee or something. Yeah, I mean, this is precisely the kind of thing. And again, so it's a word that like 2 PhDs didn't even know what it was. And it seems like a critical metric of a failure to care, right? That we have, and certainly, again, thinking about what the current crisis has made visible, it's made visible the really atrociously low quality of care in a lot of our facilities for elder people. And also for, not just for elder care, but all kinds of facilities. And I think that that's something that, again, it's partly a question of caring enough to have the political will to change these things. We would have to reprioritize things to make that happen. But
yeah,
that's, you know, again, it's a political will question.
I will say that this moment, it is this great dilemma that I look at sort of what's happening in elder care facilities and the exhaustion of people that I know who are taking care of gravely ill family members at home, and thinking, this is a place where there is no tenable option.
Right.
And I don't know what to do with that.
I think one of the questions that a lot of the care debates have, I mean, it sort of comes back to this question about who is responsible for care and how can we distribute that responsibility more equitably. And why is it so? The New York Times, since you've been reading it assiduously, I'm sure you know this, did this study about how like 80% of women say that they're doing most of the childcare, and particularly like home directing of the schooling at home. And that 3% of men are, that they're like, if they're in a opposite sex household, that only 3% of the men are doing that. And the men thought they were doing like half of it.
Right, yeah, the funny thing about that is that the men are like, it's totally evenly distributed. And then the women asked are like, it's really not.
Yeah, I mean, and the method for studying this that's been really useful are these time use studies. And so there's actually pretty, and in fact, I started on this at the very beginning, and then I realized that people much better qualified than I were already taking this on, which is that people started doing a lot of time use studies during the COVID crisis. But the time use studies, this is why I think we have plenty of data on this question, are pretty robust in showing us how uneven the distribution of care is. And again, I think that the redistribution would be good, not only to take some of the burden off the people who are now doing too much of the care, but it would be salutary for people who would benefit by being caregivers, by being more caring.
There's a question that I like, because it is a question that I would ask, that I'm going to frame as the Battlestar Galactica question. And it might be the last one for our time, which is, what kinds of care can care robots do that human beings cannot? And what kinds of care can human beings do that care robots cannot?
Oh gosh, I may be out of my element here, because I do think—
I love you're like, I should never have said care robot.
Right. Well, I mean, mostly it's because like some AI experts then come back and be like, no, the care robots can do all of that. And, you know, certainly one of the things that care robots can do that the rest of us can't is care robots don't necessarily need to sleep, right? I mean, they can be there 24 hours a day. And for people who are severely ill, they can be taking the temperature, they can be, right? I mean, I think we particularly noticed at a moment like now, but we're all supposed to be distant. How do you provide care without making yourself vulnerable, right? Or making yourself exhausted and all this stuff. So there's a kind of appeal of that. And I understand the appeal. And I don't mean to be some kind of like, I'm here with my laptop and my smartphone and everything else. I don't mean to sound like some kind of Luddite, because I certainly benefit from these technologies as well. But I think that there are limits to when we think about the sort of affective aspect. And if we're just concerned about the labor aspects of it, there's a lot of things that robots can do that, you know, but they can't create a culture, right? And they can't—
Not yet, they
can feign empathy, not feign, maybe feign is the wrong word, but they can perform empathy, but that has to be learned. They have to learn that. I mean, I suppose we all have to learn at some level, but it's, I think that it requires, you know, and they can feel kind of human, but they don't feel like bodies, right? And that's different. And ultimately, the care robots can only care about the things that we teach them to care about, right? So even the AI programs, they need to be knowing what they're supposed to be learning. And so we could program them to be more caring. That would be a plus. But that requires ourselves placing a higher premium on care.
No. Yeah. Thank you, Joey. All right, I'm gonna shoehorn in one last question that I think we can do in the next 4 minutes, because it's another one that's been on my mind, right? Which says, how do you think the proliferation of celebratory discourses about frontline workers will play out in political movements or policy making about these big issues going forward? And I will just tag on to this, that I realized that I have a very almost claws out reaction to the sloganeering of like healthcare workers are heroes when it is put forth absent anything that seems to be absent any kind of effort to stop them from having to make heroic effort. Right. And so so just to repeat the question, because I just talked so that you've probably forgotten it, is how do we think that the sentiment might translate going forward into political movements or policymaking?
I think there's nothing, sentiments don't make political movements, right? People make political movements. And I think that the only way that we convert on this current moment, and I think some sympathy for what the challenges that frontline workers are facing, is if we organize and mobilize around them. And so I think that comes in part from frontline workers themselves. I think, I've been looking at like Amazon workers going on strike, and I think a lot of healthcare workers aren't going on strike right now because we're in the middle of a crisis. But, I think that I hope that we'll see a lot higher rates of organizing and unionization and just demands for a lot more recognition of all kinds of things. And again, I think that part of that's just going to be more reasonable compensation, but part of that's also going to be more autonomy, better hours, more, just kind of more humane life, right? And again, a broader distribution of that labor so that we're not relying on this narrow set of people that are supposed to sacrifice themselves for the sake of the rest of us, right? But I think that there's no automatic conversion of the sentiment that we currently feel into a successful social movement. That's a lot of hard organizing. And when you ask, like, what is it that we can do now? Like, we can support those efforts, right? We can support the efforts of people who are trying to get rights for themselves or make demands for themselves on, and one of the things that out of the wages for housework movement, so this was from the 1970s, and that my colleague Kathy Weeks has written about, is that the point of that isn't that everybody thought they would get paid for housework, although there was some of that. And it's interesting because she kind of, it appeals to the historian in me, because she kind of traces out the way that phrase wages for housework got sort of picked up after the pamphlet that it's known for was created. But then what it really hinges on is whether you have the right to refuse to do that labor, right? That if it's a contractual wage relationship, then you have the right to be like, I'm not doing this now. And I think this is one of the things that we're starting to recognize, is the need for all of these people who are doing this essential work to also have the right to refuse to do it. And not just the right because they're, like autonomous liberal beings, but because they live in a world where they cannot do that work and still survive.
Right. And then just as a sort of final throw in the Q&A, someone points out that the New York State Nurses Association is already threatening to strike. So people are envisioning this advocacy for themselves. Okay, and that brings us to the end of our hour. Thank you so much, Jolie, for this conversation. Thank you, all of y'all, for being here and taking part in this conversation. Just to remind you, Keenan will be sending out a link to a recording of this in a few days. And next week, we will have another one with our colleague, Professor, perhaps the chair, but the James B. Duke Professor of African and African American Studies, Mark Anthony Neal, on In Defense of Terrible Television. And I say that having gotten up at 7 o'clock this morning and found myself watching Murder, She Wrote, just to be satisfied by a smart woman finding a solution in less than 60 minutes. So thank you all. Thank you again, Jolie. I hope to see you in person soon. I hope to see all of y'all sometime back in downtown Durham for an in-person Ethics of Now. And good night.